Greetings, nurses, and welcome. My name is Nixon Tan, and I'm here today to introduce myself and give you a glimpse of my teaching style. In today's video, I'll be conducting a teaching demo where I'll be utilizing a combination of lecture-based teaching and audiovisual aids. To clarify, lecture-based teaching involves delivering information through spoken words and explanations. It allows for a structured and organized approach to presenting concepts and ideas. On the other hand, audiovisual aids refer to any visual or auditory materials that enhance the learning experience, such as videos, slides, or interactive presentations. By incorporating these two methods, I am to provide a comprehensive and engaging learning experience for my students. And for today's lecture, I will discuss patient safety. It is an essential topic in the ever-evolving landscape of healthcare. In light of the current medical and healthcare situation in the Philippines and globally, it is imperative that we prioritize patient safety as a cornerstone of our practice. The objective of this lecture is to equip you with a comprehensive understanding of patient safety, principles, and strategies, empowering you to enhance the quality of care provided to patients. As we delve into this crucial subject matter, let us remember that patient safety is a shared responsibility that transcends borders. By equipping ourselves with the knowledge and skills to promote a safe healthcare environment, we can make a tangible difference in the lives of our patients, both locally in the Philippines and on a global scale. Together, let us embark on this journey towards excellence in patient safety, ensuring that every individual receives the highest quality of care, free from harm, and with the utmost respect for their well-being. So let's begin. There are several learning outcomes that we expect to learn after this presentation. One, we gain an in-depth understanding of the concepts of patient safety and its significance in healthcare delivery both locally and globally. We will explore the common causes of adverse events and medical errors, recognizing their impact on patients' outcomes and healthcare systems. We will examine the key components of a culture of safety, including effective communication, teamwork, and the importance of a system approach in preventing errors. We will identify the evidence-based strategies and best practices for promoting patient safety across various healthcare settings, with a particular focus on the Philippines context. We will discuss the role of healthcare professionals in fostering a culture of safety and mitigating risk through proactive measures such as error reporting and continuous quality improvement initiatives. We need to understand the ethical and legal aspect of patient safety, emphasizing the importance of informed consent, confidentiality, and open disclosure in building trust with patients. So we need to define what is patient safety. We need to know the real meaning of it. By heart, we need to learn. So patient safety is a healthcare discipline that emerged with the evolving complexity in healthcare systems and the resulting rise of patient harm in healthcare facilities. It aims to prevent and reduce risk, error, and harm that occurs to patients during provision of healthcare. So as defined by the World Health Organization, the reduction of risk and necessary harm associated with healthcare to an acceptable minimum. Let's watch a video to better understand a clear picture of the definition of patient safety.
Meet Dan and Maria. Dan needs to go to the hospital for a scheduled surgery. Dan and Maria aren't concerned because hospitals are safe places, right? Unfortunately, not always. Hospitals are busy, complex places where many very talented and dedicated people do remarkable work and save lives every day. In hospitals with strong leadership and teams that work together, patient safety is a top priority. Strong teams reduce infection rates, put checks in place to prevent mistakes, and create strong lines of communication between hospital staff and patients and families. All people make mistakes, but when there's a good team in place, they can look out for each other. But some hospitals don't have teams that work well together or good leadership. When one person makes a mistake, there isn't a good team ready to catch that mistake, and the patient suffers. Communication breaks down and patients get harmed. Patients experience dangerous complications, recovery is slower, and some patients even die unnecessarily. Let's take a look at two of the most common harms patients face. These harms are mistakes with medicine and infections that could be prevented. More than 1 million times a year, patients in the US are given the wrong medication or the wrong dose of a medication while in the hospital. Even the best doctor or nurse can make a tiny error with really big consequences. And every year, 1 out of every 25 patients develops an infection while in the hospital. An infection that didn't have to happen. The most shocking side of the hospital safety problem is that as many as 440,000 people die each and every year because of hospital safety problems. That's like the entire population of Miami dying unnecessarily. While many hospitals are good at keeping their patients safe, some hospitals aren't. Some hospitals have hidden dangers you should know about. The Hospital Safety Score grades hospitals on how safe they are for patients, so you can protect yourself and your loved ones. Learn how you
I hope you guys have a clear picture of the true definition of a patient safety. So why it is important for us to discuss about patient safety? Patient safety serves as cornerstone of healthcare, ensuring that no harm comes to individuals seeking medical assistance. It is imperative in the current medical landscape where advancements in technology and complex healthcare systems can introduce potential risks. By prioritizing patient safety, we can not only reduce adverse events, but also improve patient outcomes and instill trust in the healthcare system. Definitely, we need to gain the trust of all our patients in order for them to be comfortable to open about their condition. There are causes of adverse events. Adverse events and medical errors can have severe consequences on patient well-being. For example, of iatrogenic harm, or it's an harm caused by medical interventions that includes surgical complications, healthcare-associated infections, and medications errors. Diagnostic errors such as misdiagnosis or delayed diagnosis, it can lead to significant patient harm. So medication mismanagement, including prescribing errors or medication administration mistakes, it can also result in adverse events. Understanding these causes is crucial in preventing and mitigating potential harm. Let's cite an example. Consider a case where a patient receives the wrong medication due to a prescribing error. This can lead to serious side effects or allergic reactions that compromise your patient's safety. So by identifying the causes and implementing safeguards such as double checking the medications and utilizing computerized prescribing systems, and we can prevent such errors in the future. There are components of a culture of safety. A culture of safety encompasses various components that promotes a safe and reliable healthcare environment. Effective communication among healthcare professionals and interdisciplinary collaboration are vital to ensure accurate and timely information exchange. Teamwork is very important. because both within departments and across different healthcare disciplines foster a collective effort to address patients' safety concerns. High reliability organizations exemplify a culture of safety by prioritizing safety in every aspect of their operation. So, for example, imagine a scenario where a surgical team encounters an unexpected complications during a procedure. So by practicing effective communication and maintaining a culture of teamwork, the team can quickly adapt and address the issue, minimizing harm to the patient. There are strategies in order to promote patient safety. Evidence-based strategies play a crucial role in promoting patient safety. Standardized protocols and guidelines provide a framework for consistent and safe practices. Error prevention tools such as checklists or electronic medication administration records, it helps to identify and mitigate potential risks. Engaging patients in their care through education, shared decision making, and encouraging them to report concerns can also contribute to a safer healthcare experience. For example, I think some of you are here working or have an experience in emergency room, right? Yes. So consider a busy emergency department where patients' hands-off occurs frequently. Patients comes and go, family members, friends. So it's like chaotic situations in ER. So by implementing a standardized handoff protocol that includes vital information exchange, such as allergies and current medications, the risk of communication errors can be reduced. So we can ensure patient safety in this manner. Healthcare professionals plays a crucial role in fostering a culture of safety. Proactive risk management involves reporting errors, near misses, and hazards to identify systemic issues contributing to patient harm. A just culture encourages an environment where individuals feel safe to report errors without fear of punitive measures, allowing for organizational learning and improvement. Root cause analysis help identify underlying causes of adverse events, enabling targeted interventions to prevent similar occurrences in the future. For example, suppose a medication errors occurs in a hospital setting. By promoting a just culture, healthcare professionals are encouraged to report the error, allowing for a thorough investigation to identify the root cause. The findings can then be used to implement system-level changes, such as improved medication labeling or additional staff training to prevent future errors. So there are ethical and legal aspects in patient safety that we need to consider. So this is like where the moment that you don't want to hear the word from your patients like, I'm going to sue you. Of course, we don't want to have a legal battle in regard to this. So patient safety is closely tied to ethical and legal considerations. Healthcare professionals have ethical obligations to prioritize patient well-being, obtain informed consent, maintain patient confidentiality, and engage in open disclosure when errors occur. Understanding the legal implication of patient safety is essential to ensure compliance with regulations and protect patient rights. So for example, informed informed consent is a critical ethical aspect of patient safety. For sure, everyone really knows how important the informed consent is. So by ensuring patients have a clear understanding of their treatment options, associated risks, and benefits, healthcare professionals empower patients to make informed decisions about their care. In conclusion of this lecture, patient safety is a shared responsibility that transcends border. By prioritizing patient safety, we can enhance the quality of care provided to patients locally in the Philippines and globally. Through effective communication, interdisciplinary collaboration, and evidence-based strategies, we can foster a culture of safety and mitigate potential risks. Understanding the ethical and legal aspect of patient safety, it ensures that we uphold patient rights and promote trust in healthcare. Let us apply the knowledge gained today to make a meaningful impact on patient safety and the well-being of our communities. So if you have some, thank you very much for your precious time, nurses. The floor is now open for questions, or if you want to share your personal experience or input in regard to patient safety, feel free to do so by messaging your comment in the chat box below, or you can shoot me an email and I'll get back to you as soon as I can. Thank you and take care now. Have a great day. Goodbye.